Hey everyone, welcome back to Injecting Knowledge, your go-to channel for nursing school success. If you're new here, I'm Nurse Kaylee, and today we're diving into a super important topic, chest tubes. We'll cover what they are, why they're used, how to care for them, and of course, some high-yield NCLEX tips. So grab your notes and let's get started. A chest tube is a flexible tube inserted into the pleural space to drain air, blood, or fluid. This helps re-expand the lung and restore proper breathing. It's often used for conditions like pneumothorax, hemothorax, pleural effusion, or post-surgical drainage. A pneumothorax means that there's air inside the sac. A hemothorax means that there's blood inside the sac, and a pleural effusion means that there's fluid inside the sac. Just to help you understand this a little bit better, a pneumothorax means that there's air inside the sac. A hemothorax means that there's blood inside the sac, and a pleural effusion means that there's fluid inside the sac. The sac is supposed to be negative pressure. However, when we have fluid, blood, or air inside that sac, it causes a positive pressure, which then causes the lung to collapse. Therefore, we use a chest tube to drain that positive pressure out of the sac to make it negative pressure again so that the lung can re-expand. Now let's talk about how chest tubes are placed. Typically, they're inserted at the bedside, in the OR, or in the ER. The location depends on the issue. For air, like a pneumothorax, the tube is placed higher in the chest, second to fourth intercostal space. For fluid or blood, a hemothorax or a pleural effusion, it's placed lower in the fifth to sixth intercostal space. The insertion site is numbed, a small incision is made, and the tube is inserted and sutured in place. It's then connected to a drainage system, which brings us to our next topic, chest drainage systems. A chest tube connects to a drainage system that has three chambers. The first chamber is a collection chamber. This collects drainage from the pleural space. Chamber number 2 is the water seal chamber. This prevents air from flowing back into the chest. And chamber number 3 is the suction control chamber. This applies negative pressure to help drain fluid or air. As nurses, it's our job to monitor the patient and the chest tube system. Here are key nursing interventions. Assess the drainage. If drainage is bright red and over 100 milliliters per hour, notify the provider immediately. Monitor for air leaks. Bubbling in the water seal chamber could indicate a leak. Keep connections secure. Always check that tubing is taped and properly connected. Never clamp the chest tube unless ordered. Clamping can cause a tension pneumothorax. Keep the drainage system below chest level. This ensures proper drainage by gravity. Alright, let's talk about some NCLEX style questions you might see. Here's one. A patient with a chest tube suddenly becomes short of breath, their oxygen saturation drops, and you notice continuous bubbling in the water seal chamber. What's your priority action? A. Clamp the chest tube. B. Call the provider. C. Check for disconnections and air leaks. And D. Increase the suction setting. The correct answer is C. Check for disconnections and air leaks. And that's a wrap on chest tubes. I hope this video helped you understand chest tubes much better. Thanks for watching, and I'll see you in the next video. Stay confident, stay prepared, and as always, keep injecting knowledge.